Okay, let me brief you on something that is very important. As a public health advocate, I try as much as I can to engage the government in certain policies that would help build our healthcare sector. Now, over the years, I've come to understand that our government can actually make our healthcare system better. Okay, a government official is sick, he flies himself abroad for medical tourism. Some time ago, the president was sick. The country spent millions that would have been invested into the healthcare sector for his treatment. Now, this is just common sense. They may say, okay, instead of bridging what is in our healthcare budget, let's just fly the president for medical treatment. But if Nigerian government can actually increase on healthcare budgetary, an average individual has access to insurance, healthcare insurance, an average individual has access to out-of-pocket expenditure, whereby you go to the hospital, you will not spend heavily on healthcare products such as drugs or services. If our government can achieve it, if our government can go beyond having bed spaces in our hospitals to equipping our hospitals with state-of-the-art facilities for surgery, having constant power supply, having medical officials, healthcare providers in place, having all it takes to have a good healthcare system, medical tourism will be a thing of the past and our healthcare system would become better. But as we always say, this is Nigeria. Most of those things seems difficult, but actually they are not. Our government, they know all these things. They know what it will take to make our system work. It's not as if they don't know. They know what it will take to make our system work. They travel abroad. They visit other developed nations. They see things for themselves. They go to hospitals to receive treatment. They see these things. They admire these things. But why are they not implementing on it? It all boils down to one thing, which we all know: corruption. As a form of advocacy, I would always try as much as I can to engage the government, to tell them we can do better, we can afford better. It all takes being willing to do that. If we can do that, our healthcare system would be better.